The following segment is sponsored by the Dermatology Associates and Surgery Center.
And welcome to today's edition of Ask the Expert. I'm Shea Paul, and I am here in the studio with Whitney Rose, nurse practitioner with Dermatology Associates and Surgery Center. It's such a mouthful to say.
Yes, it is.
Whitney, this is your first time with us.
Yes, it is.
We are pleased to have you here.
I'm glad to be here.
And
Thank you, Shea.
we're going to talk a little bit about a common skin condition that you see there at your practice, and it's called seborrheic keratosis. And you mentioned to me earlier that you do see quite a few of these cases.
Yes.
And so we're going to talk a little bit about what exactly it is and what causes it, right?
Yes.
Okay. And so what exactly is it and what does cause it?
Okay, so seborrheic keratoses, they are warty benign growths that we tend to get with age. They happen between the ages of 40 is usually when they start out, but they can happen as early as 30 as well. The cause is actually unknown. They can be genetic. There's a genetic component to them because we actually see them run in families. But yeah, the cause is unknown.
Okay. All right. So when someone sees this, because we've got some pictures that are coming up on the screen so people can get an idea of what they look like, I'm sure they can probably be mistaken for cancer at times,
absolutely,
right?
Absolutely. So even though that they are benign, I always recommend that anyone who has seborrheic keratoses actually be seen by a dermatologist or a dermatology clinic because they can mimic skin cancers.
Right.
So they can be large, they can grow quickly. They tend to even become irritated, and the color can be dark or even black. So all those are signs that they need to get checked out to make sure that they're not actual skin cancers.
Right, okay, and that's always good advice. Now, let's say someone does come to you for treatment. What are the treatment options?
Okay, so a lot of times, even though they are benign, they do want to get treatment because they can become irritated. They can snag on clothing or rub on clothing. They can, you can nick them when you're shaving or combing your hair. So there are multiple treatment options. The first and the one that I do the most is actually I do liquid nitrogen.
Okay.
And that's where we spray the lesion and it freezes it, and then 1 or 2 weeks later it'll slough off depending on the size. Sometimes we have to spray them more than once. It just depends on how thick they are and how large they are.
You do that for warts as well,
yes,
correct? Okay.
There's all kinds of stuff you can do with liquid nitrogen. It's pretty awesome.
Right. Okay. And are there any other treatments?
Yes. So if you just want it gone that day and don't want to deal with it anymore, we can actually do a shave removal where we just shave it off after numbing, and you walk out of the office that day and it's gone. And there's also prescription lotions and creams that can be applied that will soften the area and make them less thick and less irritated.
Okay, so that might be a less invasive way of treating it, right?
Yes.
Okay, so now I know you are at the Taze Valley location, correct?
Yes, that's correct.
But there are locations everywhere, right?
Yes,
so
there
maybe you
is.
can run down a list of those for our viewers.
There is Beckley, West Virginia. There's Princeton, Logan, as you said. There's Charleston, Taze Valley, Martinsburg, and Hagerstown, Maryland.
Okay, so you've got it covered.
Yes.
And that's great information, Whitney. Thanks so much for being with us today.
I'm so glad that I could be a part of this. Thank you so much.
My pleasure.